Okay, so my name is Tanaya DeVore. I have been doing healthcare for 20, 30 years now, worked in nursing homes. Then I went into private healthcare, home healthcare, worked for many agencies, and I finally decided that working for the agency was not the way to go. Not for me, not for the client. For one thing, they charge way too much for the private pay clients. You could work directly for the client as if they're private pay, which means they're not going through insurance, they're just self pay. And they just write you a check every week for your services. You can determine how much you're going to charge, $12 an hour, $14 an hour. You set your own rate. The agencies generally are charging the client like 20 something an hour for private pay, which I think is ridiculous because you can work directly for them and charge them a lot less, save them money, and they just pay you directly. So I can provide you with all the forms. Uh, Basic contract, very simple. There is some sign-in sheets where you log your hours for the week, then the timesheet, which is at the end of the week, what you use to figure up your pay, how much you are owed for that week. You decide when payday is, if it's once a week, every 2 weeks. You discuss all of these things with the client. You set it up for you and the client based on what your needs are and what their needs are. And then you'll have, I can give you the documents to use that I've used for a small amount of money. I'll charge, since I created all of them, or you can create your own documents to use, like the timesheets and the sign-in sheets, the vital sheet to keep track of your client's vital signs, and you'll have a logbook. You're going to want to do that. Create a notebook where you write down what you do for the client every day. The most important things, like whether they took certain medicines or, whether you did the dishes for them or whatever you did for that day. So you log your activities down. You keep track of your hours. At the end of the week, you figure out the pay. You sit down with the client, and they'll write you the check instead of going through medical insurance. They just pay you directly as a private pay client and as you as an independent healthcare giver. It'll be up to you to keep track of your taxes. And I deduct my mileage. That's basically what I deduct. You can do what you want to do, but I want to claim it as income, so I do. So I do have to pay taxes, but I do deduct my own mileage. So that is an expense that helps me to pay less taxes on what I earn. I charge $12 an hour. I could charge more, but I've worked with this lady for 4 years. A lot of these clients are on a fixed income. So the 20 some dollars an hour that these healthcare agencies are charging for the same thing that I do is ridiculous. And I think that you can do a better deal. You work out your schedule, you decide when you're going to work, you decide what you're going to charge. You have a lot more control over things than if you're working for an agency, and it's up to you and the client to work out the details of whatever contract agreement you come up with. And like I said, I can provide you with documents, papers, things that you can tailor to be your own, and you just fill in the blanks like with your name, the client's name, etc. I'll give you all those forms to use to get started, or you can create your own. But really, it's pretty simple, and there's no reason to have to go through an agency or to go through an insurance company, especially if the client is self-pay. Now, if they're wanting to go and go through their insurance, then it's better if they go through an agency. But for me, I just get paid directly by the client for the healthcare services that I provide, light housekeeping, personal care, giving showers, making beds, doing dishes, making meals, just very simple things that you're probably already doing. Maybe you've taken care of a loved one, You don't even have to necessarily have a bunch of experience. It could be just that where you took care of your mom or your dad and before they passed, you maybe provided them with care so that they didn't have to go into a nursing home. It's really very straightforward, common sense kind of stuff. So you wouldn't necessarily have to have a lot of experience, just have to be able to take care of a person's basic needs. And most of us are capable of that. So you decide for yourself. But I really think if you want to do independent healthcare, there's no reason why you can't. You can get your own clients. You can put business cards out. I'll give you a template to use that I used, or you could just fill in your information to make your business cards. But once you have a client or you find clients, you can get added to the list at the hospital. The social services department, they keep a list. Most hospitals have somebody that works with people that come into the hospital that they can't send home unless they have caregivers in place, and you could be that person. So I would get on the lists with the different hospitals, social services department to make yourself available as a caregiver, as well as putting out business cards, talking to family, friends, posting on social media, let people know that you're a health caregiver and that you're available to provide those services. There is a website, caregiver.com, I believe, is also a website. You can find clients that way. Um, but if you want to do it, there's no reason you can't. Like I said, I'll provide you with all the forms if you want, or you can create your own forms, but it's not real complicated, and it's definitely worth it. It's much better for you. It's better for the client. It's more of a win-win situation than the client having to go through an agency.